This is Dr. Joseph Baker from the Limerick Chiropractic Center, and I want to welcome our patients to your Tuesday night workshop. Now, our workshops are part of all of our patients' care. It's something that we do because we recognize the bigness of what's at stake in our healthcare system. And that is to make sure that we're delivering information to you that allows you to take more control over the outcome. In fact, one of my big desires is that, as we teach and train you, you stop doing bad things that cause your body not to move forward as quickly as possible. And I want to make sure that you're learning those good and better behaviors so that in the future you're protecting yourself from future problems. So tonight we get to jump into a conversation. We get to have a little bit of a talk about carpal tunnel syndrome. We see numerous patients in a chiropractic office that come to us with tingling and numbness in the fingertips, or they describe it as, "Doc, I could hardly open a jar anymore," or "I'm sitting there at my computer and my hands are just going numb on me." Well, here's the thing. Oftentimes, even though that's how we see people present, we've come to recognize that what they're complaining about and what the problem happens to be are two very different things. So tonight, one of my hopes is that you're going to learn about some of, how we dig into actually discovering what's going on. How we discover where the root cause of the problem happens to be. And hopefully, as you recognize that, hey, listen, this is information that absolutely everybody needs to hear, you're doing your part. Your part as a patient at the Limerick Chiropractic Center is, number one, to like this video. Number two is to, let us know what your big takeaway is. What's the thing that, it was just surprising for you, or just, that change, that shift for you in regards to some things that you're doing. But then to share the information, to share it so that other people can learn about the experience. If you choose, you can tag them in this in order to make sure that they see this information. Nothing that we're going to share tonight is ever going to have that opportunity of hurting and damaging. The only thing that happens is that the system is improved and simply works better. So, with that being said, what is carpal tunnel syndrome? Really simply, it occurs when too much pressure is on the nerves in the wrist. Now, that sounds like a very oversimplistic definition, and that's because it really is. Oftentimes, we in medicine put labels on things. And listen, type A personalities are not very creative. It's either named after them or it's named after the body part where they're finding the problem. Well, in this case, it's just simply describing a pain in the wrist. That's all it is. Doesn't tell you what the problem is. Doesn't tell you where the problem's coming from. It just simply tells you as a mere abstract, little description of what is occurring. It's a pain in the wrist. Now, a lot of times when they talk about carpal tunnel syndrome, we talk about tingling, numbing in the fingertips, pain in the wrist. Sometimes we experience shooting pain up the arm. And we're going to talk about why is it that that actually happens. Now, oftentimes people don't realize that women happen to be more suspect of having this occur than men. Now, if we realize that, a lot of times we would think that, it's just from computer use. Yes. But unfortunately, when we start looking at how our bodies are put together, how our bodies function, the tendency towards this occurring in women happens to be higher than in men. Now, guys, don't kid ourselves. That doesn't mean that we're immune to this. Just because we're less likely doesn't mean that if we get ourselves set up for failure, we are not going to be one of these statistics. And the problem is that we never think it's going to happen. Because this is one of those things that has that very slow, very insidious onset that a lot of times we just associate with repetitive motion activities. Well, not always the case. In fact, probably happens more often than you really think. And you know, you see these numbers up there, those are some pretty big numbers. Listen, does anybody really want to be one of these statistics? The answer is absolutely no. So, as we move forward, we want to recognize part of our conversation, part of you learning about carpal tunnel, is how do you protect yourself? I mean, if you have it, great, we're going to learn more about it. If you don't have it, well, let me tell you, you're going to learn how to protect yourself so that you don't ever become one of those statistics. So, just as a little bit of background, the carpal tunnel is here in your wrist. All right? Now, the wrist is made up of 8 really tiny bones. And unlike the bones in your spine that have these nice flat surfaces, these joints that glide across one another, let me tell you, the bones in the wrist, not the case. They are all different sizes, different shapes, none of them locked together, but that's there for a reason. It gives you great mobility, a lot of function. You're able to move in so many different directions. That's why your body was designed that way. And in fact, like you see in the diagram here, there's 2 nerves that go through this little tunnel, this little channel. In fact, you're going to see it here. You know, you're going to see that's looking at the wrist from the side or on end. And in turn, it's a little tunnel that 2 nerves get to go through. That median nerve is that main nerve, and that's the one that's most often involved when we have irritation to the carpal tunnel. So, I know you're not here for an anatomy lesson, but it's really important to understand. In fact, one of the things that you're going to notice is across the top here is what's called the transcarpal ligament. And this, like you're going to hear in a little bit, is like the lid that's on a pot that keeps everything sandwiched together. This way, all those structures, all those bones, and all those nerves, they stay in one place. If it's not there, well, let me tell you, it changes the mechanics. Really bad things happen. Now, a lot of times, the symptoms, they vary. Now, these are some really common ones. You know, some common things that a lot of people say when they're developing this. When they're developing this pain in the wrist. I can't open the jar. I can't lift things. I tried to carry a gallon of milk, and I almost dropped it. I can't tell you how many times I hear that. Or bags of groceries. I can't even hold on to the hairbrush anymore to do my hair. No pun intended, by the way. So, but our body can give us any of 100 different signals. And they could be remarkably different from one day to the next. See, we just imagine, you know, it hurts here, therefore my problem is here, and that's where I have to address. But one of the things that we recognize is that oftentimes, you know, and I'll refer you back to the workshop that we did on the safety pin cycle, is that, well, nerves not only send signals out into the body, they also receive information and bring it back to the central nervous system. Well, if you have enough irritation down here, it's going to send signals up, and that's oftentimes why people also get things like tennis elbow. They'll get pain up into the shoulder or into the base of the neck, and we'll discuss why that actually happens. Now we get to step into some of the causes, and I'll tell you what, this is really important because you're going to recognize there's so many different causes for this to happen. In turn, it doesn't matter how this gets started. Quite honestly, once it's there, we're going to talk about the most important thing, which is how to get rid of it. So, how does this cause happen? There's a couple different ways. When we're talking about pain in the wrist, carpal tunnel syndrome, we realize one of the really big causes is that it happens to be gradual. It happens to be from the repetitive motion activity. You know, doing the same thing over and over again. Think about it. Our grandparents they were just 2 generations before us. They barely had a typewriter. There were no computers. Nobody worked on a computer. The only reason why you were doing repetitive motion activities as far as fingers are concerned is because you were on a typewriter. Now, there are other jobs that were there that required repetitive motion with the hands and the wrist. It just so happens that, you know, typing, if done improperly, happens to be one of the really big things that puts you in a position where this is created, the repetitiveness causes the damage so very quickly. But that's only one of the ways, is creating inflammation that is down there. Now, along with that, you know, we also see that there are what are called entrapment syndromes. And this is really important because I don't want to give you the illusion that there's only one way. Entrapment syndromes means that this little opening that's here that allows the nerve to come through gets smaller over time, or there's fluid that builds up in there, all right? Now, we have pregnant patients in our office. Let's understand, a lot of times when you're pregnant, we accumulate fluid within the body. Our body doesn't filter it out, get rid of it as rapidly or as easily as it would oftentimes. So what happens? Well, that fluid accumulates, well, down in our feet and our ankles, one of the really common places. The other, if our hands are hanging down, well, it starts accumulating in our wrist also. Well, let's imagine we have a pot on the stove. How much water can you put in that pot? I don't know. If it's a quart pot, you can put a quart of water in it. What happens if you try and put too much water in? Well, I think we all know what happens. We've all done it. You know, overfill a cup on the counter, and all of a sudden water spills out on the counter, just makes a mess all over the place. In our body, with this carpal tunnel, remember that transcarpal ligament. It acts like a lid. Now, water's not going anywhere. More like a pressure cooker. Because what happens is the pressure inside builds up. And unfortunately, the really soft structures that are inside, because bones don't compress real easily, but nerves do. The nerve can be choked or compressed by that additional pressure. That is one of those indications of an impingement syndrome. Likewise, just like if a bone comes out of place. If one of the bones in your wrist subluxates and it comes out of its normal alignment and it doesn't move properly, well, in certain positions, it's going to close the opening down. It's going to trap the nerve, and the nerve is going to get irritated. And if we're not doing what we're supposed to do, if we're not positioning our hands properly across the keyboards, or, you know, when we're using the mouse, well, now it is that slow but steady walk down injury lane. And how many of us, you know, have somebody just like in the gym who's there to spot us? Well, when we're working, nobody is. I mean, listen, I've walked into the kitchen at my house and I've seen my daughters on their computers, and I have to stop and I have to say, you know, sit up, move into this position, because we can't feel what we're doing. Unless we have somebody who helps guide us through the setup and periodically slips and checks it, well, there's no way that we know that we're in exactly that right position. Now, we oftentimes help people with their ergonomic setup, so we're able to help to guide them to that they sort of position themselves into a better place. Well, listen, we've seen really stupid things, really bad choices. So somebody can take a perfectly designed chair and sit in it poorly, and what happens? Bad posture. That bad posture leads to a weakened nervous system, which ultimately weakens our body and creates a state of dis-ease. Is that okay? Absolutely not. So, as we look at this, I want you to understand that the nerves that come all the way down to your wrist here, all the way down to the bottom here, those nerves, they come all the way up from your shoulder. In fact, they come from the base of your neck. We're going to be talking about that in a minute because, unfortunately, we realize, as many do, if you're not getting to the root of where the nerve is irritated, well, you're just putting a Band-Aid on the problem. In fact, this is why, more times than not, people become frustrated. It's why carpal tunnel syndrome happens to be one of the leading causes of disability in the United States. Because if you don't get to the root cause of why it is you feel the way you do, well, you're just going to be like that hamster on the hamster wheel. You're just going to keep running and you're going to go round and round and round, never getting to the finish line. Listen, I've watched those dog races. I've seen those little bunnies going around the track. And let me tell you, dog's never going to catch it. If you're not dealing with the root cause, you're never going to get to where you want to be. You're never going to win the race. Oftentimes we're taught, as long as you feel good, it's okay. That's not enough. Because if we're just putting a Band-Aid on the root cause of our problem, we're not even using a Band-Aid on the root cause, but just on the symptom, well then guess what? We're only living in that world of insanity, and that's definitely not okay. So, some of the treatments, some of the things that you guys need to be aware of. I mean, this is stuff that, we know is oftentimes out there, and people are always told, try this first. Let's try this before we get to, what? Surgery, right? Because that's the end all. The ultimate correction in the medical world is if we do surgery, if we change the function of the body from the outside in, everything's going to be okay. But let's do this first. So what's the very first thing? They always tell you, here, let's do some exercises. Let's strengthen the muscles. We're going to do some therapy. Now the problem is that from time to time, this is actually going to be beneficial to reduce the pain. Do we just want to reduce the pain? The answer is no. That's one of those things where we realize that, hey, listen, we can exercise our muscles as much as we want. We can do as many push-ups. We can do as many stretches. But the sad thing is that muscles are really stupid. Muscles only do what the nerves tell them to do. So in the end, if we're only stretching the muscle, guess what? If we're not dealing with the root cause, then sadly, the muscle's just going to tighten up again. And this is why oftentimes they say, well, hey, listen, you know what? It's not enough that you're stretching. It's not enough that you're, maybe icing the area or putting heat on it or doing this therapy. You need to take medication because your body needs help. It doesn't know what it's doing. It's got too much inflammation. We have to kill the pain, stop the inflammation, and, oh yeah, by the way, relax the muscles. So here's 3 prescriptions all at one time. Yeah, I'm going to tell you, I give the pharmaceutical companies a lot of credit. They develop a medication. It does what it's supposed to do 90% of the time. Might it bring, a whole luggage full of side effects with it? Absolutely. It's going to churn up your stomach. It's going to screw with your digestive system. It's going to cause all different types of reactions. Most commonly, before your stomach gets upset, it's going to give you a skin rash. Just saying. But is it changing the cause of the problem? The answer is no. Listen, it's like you and I going out to our car and instead of putting oil in it, when the oil light comes on, putting a Band-Aid over top that oil can, that red oil can that shows up on the dash, the check engine light that's right there. If all we're doing is putting a Band-Aid on it, listen, oil fairy does not come along and fix the problem. If you choose to be delusional and then think that, then we're on to the next level of insult. which oftentimes leads to not only cortisone injections, because listen, it's not enough that you stick these pills in your mouth, but let's go ahead and we're going to stick a needle directly into this area so that we can deliver this very strong anti-inflammatory right to where the nerves are irritated. Can this work? Yes, it can work. Does it stop the inflammation? If you haven't caused, if you haven't changed the mechanics, if you haven't fixed and corrected the root causes, then sadly, you're just going to eventually be back to where you were. In fact, in a much worse place, because the mechanics have been bad and you've still been using it. It's like running your car down the road with the tires out of alignment. The more you run it, worse it gets. So we're going to do surgery. I want you to imagine what happens is in this surgery, somebody comes along and that pot that's boiling on the stove, it's boiling away and all that water spurting out the side. The surgeon comes along and picks up that lid and takes the lid off and puts it off to the side. Is the water spurting anymore? No. The boiling slows down just a little bit. And here's the problem. In carpal tunnel surgery, that ligament that's supposed to be going across your wrist, it's there for a reason. It's there to hold everything together. It's to make sure that all those bones work the way they're supposed to. But what we're going to do is we're going to slice through there. We're going to cut that open so that everything relaxes. So we've lifted the lid off. We've taken the pressure off. The problem is that it never works the same again. You were designed and created. This wonderful body of yours was put together not by chance, but with purpose. And as that purpose and as that design is being changed, it doesn't go back to the way it was. It's altered forever. See, and the sad thing is that, yeah, you could be lulled into the fact that, well, hey, listen, it feels better for a while. But mechanically, we've created all types of new problems. So, as we move forward, there are other options as far as treatments are concerned. And this is one of the things that most people aren't aware of, are some of what are called the conservative treatments. Don't let me kid you. Are they conservative? Oh yeah, absolutely. They're conservative in relationship to the fact that they don't have the side effects that medications and surgeries carry with them. Therefore, they're labeled as conservative. Not less effective, just not as many downsides. So, when we start looking at this, one of the very first things is, hey, listen, you know what? Sometimes we have to force ourselves into resting these joints. Do we want to wear a brace forever? The answer is absolutely no. Our body is designed to be in motion. Guess what? We're going to use the brace to remind ourselves to stay in the proper position and limit motion so that those joints can actually relax a little bit. They can calm down. But this is only the beginning of this. Oftentimes we forget about the fact that our nerves require nutrients in order for them to heal. Well, let me tell you, very simply, B6 is a nutritional, it's a vitamin that most people don't even think about taking. They use a B complex, it has a very minimal amount. But if in fact your nerves are damaged, you need a much higher level. Oh, and let me just tell you, it has to be purposeful because B6 is just like vitamin C. It's water soluble. If you put it in and after a day, it's coming out the other end if your body doesn't use it. So you have to be constantly taking it in. And there's things that we put into our body that cause us to actually dump it out. Let me think. Coffees, teas, alcohols, other chemicals do. And then there's this little thing, and you tell me if you don't have this in your life. It's called stress. See, all these things cause us to dump this out. how could we expect that our body's going to rebuild the nerves and allow them to heal if we don't give it the supply that it needs, the building blocks that it requires? Now, there's other nutrients that are there that we could talk about. In fact, there's other activities, the tractioning exercises, certainly your chiropractic care. We started the conversation with there's other areas. Oftentimes there's tests, they're called NCVs and somatosensory evoked potential tests, that recognize that as they trace the signal that is causing the pain and where it comes from, it radiates from the neck down. The problem is that oftentimes when we have subluxations, when those bones are out of place and it causes the posture to change, in other words, we lose the curve in the neck, it irritates the nerve. Those nerves can't communicate with the muscles down our arms and to our fingertips the way they're supposed to. See, and the sad thing is that if you're not dealing with the basic, which is getting your spine back in place and making sure that things are properly aligned so your brain is able to communicate information properly, all that other stuff is meaningless. Your body is never going to allow the nerve to heal if, in fact, you're fighting two battle fronts. The healing in our body comes from above down and then the inside out. And this is so very important because we're oftentimes taught, deal with the site of pain first. Just deal with that. But the problem is that we really have to deal with both ends of the equation. Because if not, our body is not going to heal as rapidly as we want it to. In fact, if we're only dealing with the site of pain, well, let me tell you, can you improve it? The answer is yes. Is it coming back again? The answer is absolutely yes. Because you're not actually dealing with the root cause of why you feel the way you do. Now, there's things like laser treatment, which actually were designed. In fact, this is why the cold lasers were actually put onto the market by the FDA, were allowed onto the market, was because of how they allowed for the nerves to be altered and changed, how they allowed them to heal even more quickly. The wonderful thing is that these are simple and easy. It's a painless process, and it only takes a few minutes. But not only does it allow for the nerves to regenerate, but it also releases what's called endorphins and kinins into the tissue, which is code for natural painkillers. It hits the check boxes to allow the body to move forward even more quickly. I know tonight we could have dug into this conversation. We could talk about this for weeks. This is one of those conversations I love getting into. But we're not going to overcomplicate this process. Because I'm going to tell you, we all know somebody that is in our workplace, one of our friends, one of our neighbors, one of our family members, who's struggling with a problem like this. In fact, the really sad thing is that in today's day and age, because our children are being slaved with these computers and these iPads, the sad thing is that they are becoming more and more susceptible to the damages that cause these carpal tunnel syndromes. Listen, I make no qualms about it. The biggest gift that we give our community at the Limerick Chiropractic Center is the ability for people to get checked. Because the one thing I know is that when we have the knowledge of what's going on inside of our body, it actually gives us power over our problem. We don't have to live in fear. We don't have to live with, just the unknown. We get to identify where the problem's coming from. We get to formulate those action steps that need to happen in order to get us back to that better place so that we can re-engage and live life the way we desire to. I'm going to ask you to do those 3 things now. Like this video, leave me a comment. I want to hear what your big takeaway was. Some of you might have further questions about some of the different things that we literally just scratched the surface on. And finally, share this. Share this with your friends. Share it with your family. Because in that moment, you give them the opportunity of allowing them to have that greatest gift. The choice. The choice of functioning better. Our newsletter this past week talks about the fact that if in fact that friend, that family member, that neighbor of yours ends up in front of that orthopedist or surgeon first, they're 45 times more likely to end up having surgery. Whereas that individual who ends up in a chiropractic office getting checked and getting to the root cause of why they feel the way they do, the likelihood is remote at best that they're ever going to have those dangerous surgeries, becoming one of those statistics. My desire, we just simply get the information out there. I choose not to stand by the side and just simply allow people to become one of those statistics. I hope you do the same. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.